all-new 11 Alive Thunder Truck, a mobile weather center with the power and speed to chase down the strongest storms and bring you on-the-ground conditions. The 11 Alive Thunder Truck, sponsored by Landmark Ram.
Here in Atlanta, bad weather means bad traffic. A few drops of rain could destroy a commute. But that's where my man Crash Clark comes in. I go street level, he goes next level. Together, we make sure you get to work on time. Morning Rush, weekdays 5 to 7 on 11 Alive. Hey, quick, open up your phone camera right now. Aim it at the screen to download 11 Alive's new and improved app. This QR code will take you right to the App Store or Google Play. One simple tap gives you enhanced radar, street level zoom, and severe weather alerts. It's just that easy.
Journalism that gives you a real voice.
At Morning Rush, that's our commitment each and every day.
And why we're honored to have been recognized for Best Morning Newscast for the second year in a row.
If you haven't yet, check us out. See why we're where Atlanta speaks.
Atlanta roads are my thing. ITP, OTP, Ponce, Piedmont, all the peach trees. Combined with Chesley's street level forecast, that's a lot of tech and experience to help your commute.
Morning Rush, weekdays 5 to 7 on 11 Alive.
We're quite the combo.
The President of the United States was accusing you of voter fraud.
Oh, I know it, and I knew it wasn't fraud.
Mr. James Blaylock voted in the election, the president's campaign tweeted. The only problem, he passed away 14 years ago. False. James Blaylock did not vote. Mrs. James Blaylock voted.
After our investigation, national news outlets owned up to their false claims, and the president's campaign deleted the tweet.
Weather changes can make or break your day. That's why the 11 Alive Storm Trackers are always watching what's coming next, delivering accessible and accurate forecasts that prepare you, not scare you. The Storm Trackers, only on 11 Alive.
COVID-19 is still spreading in Georgia. Now get facts, not fear, at 11alive.com/COVID numbers. Track cases by county using our interactive map and get the latest health department data. Visit 11alive.com/COVID numbers.
A sign of relief across half the nation. The rest feeling devastation.
In Georgia, we can now focus on the 2 Senate races here that are still unresolved.
It's not over yet. You can still make history. The balance of power in Georgia voters' hands, whatever side you take, could determine the nation's fate. Your vote still matters. Stay involved, stay informed with journalism that gives you a real voice.
Breaking news, the hand tally of nearly 5 million votes is now complete.
Right now, no matter how you add it up, our cases are rising.
We do have a flash flood warning that just popped up here.
The hand retally, that's done. This is going to a recount, and the taxpayers will foot the bill for a third time.
Morning news should be both informative and fun.
Gone are the days where we're speaking at you. On Morning Rush, we're speaking with you.
So connect with us. Talk to us.
Think of it as a conversation.
Morning Rush, weekdays 5 to 7 on 11 Alive.
Quick, open your phone camera right now, aim it at the screen to download 11 Alive's new and improved app. This QR code will take you to the App Store or Google Play. One simple tap gives you enhanced radar, street level zoom, and severe weather alerts. It's just that easy.
As COVID-19 continues to impact our state, the need for food is bigger than ever.
In fact, 1 in 4 kids in Metro Atlanta live in a home that lacks access to adequate food.
But here's how we can take action to help.
The next time you're shopping, grab some extra canned goods.
And drop them off at 11 Alive's Canathon with contactless drop-off December 4th.
Or visit 11alive.com/Canathon for 3 easy digital ways to give.
11 Alive's annual Canathon. With your help, we can stamp out hunger in Atlanta.
Morning news should be informative and fun.
Yeah, and we do that here on Morning Rush with Verify, Connect the Dots, Why Guy, and more.
We love learning about new things and sharing them with you.
We make the news make sense.
Morning Rush, weekdays 5 to 7 on 11 Alive.
The Negro people had to leave. They were told to get out.
White only, no black!
1912, all but one issue has been erased.
We haven't had none up here since the 1st of the century.
What's the importance of making sure this history isn't erased?
So that it doesn't happen again.
Is your morning routine feeling a little routine?
Then mix it up. Morning Rush is different.
It's the fast-paced news you need
with all the energy of your morning coffee.
Come see the difference on Morning Rush, weekdays on 11 Alive.
Weather can't run from the all-new 11 Alive Thunder Truck, a mobile weather center with the power and speed to chase down the strongest storms and bring you on-the-ground conditions. The 11 Alive Thunder Truck, sponsored by Landmark Ram.
Here in Atlanta, bad weather means bad traffic. A few drops of rain could destroy a commute. But that's where my man Crash Clark comes in. I go street level, he goes next level. Together, we make sure you get to work on time. Morning Rush, weekdays 5 to 7 on 11 Alive. Hey, quick, open up your phone camera right now. Aim it at the screen to download 11 Alive's new and improved app. This QR code will take you right to the App Store or Google Play. One simple tap gives you enhanced radar, street level zoom, and severe weather alerts. It's just that easy.
Journalism that gives you a real voice.
At Morning Rush, that's our commitment each and every day.
And why we're honored to have been recognized for Best Morning Newscast for the second year in a row.
If you haven't yet, check us out. See why we're where Atlanta speaks.
Atlanta roads are my thing. ITP, OTP, Ponce, Piedmont, all the peach trees. Combined with Chesley's street level forecast, that's a lot of tech and experience to help your commute.
Morning Rush, weekdays 5 to 7 on 11 Alive.
Well, good morning, everyone, and happy New Year's Eve. I want to, as always, thank Dr. Toomey for being here with us today, and thank her and her team as well, and many others for all they're doing every day. We wanted to give you a quick update this morning on the vaccine administration and planning before the holiday weekend. As you all know, earlier this week we rolled out the COVID-19 vaccine in our nursing homes as well as our long-term care facilities, thanks to the incredible partnership that we have with the private sector and great partners like CVS and Walgreens. That is a key step, obviously, in our fight to end the virus here in Georgia, and I want to again express my deep gratitude to the countless nurses, doctors, public health workers, and long-term care facility staff who have rolled up their sleeves in the last few days to get the vaccine. On Tuesday, GEMA Director Chris Stallings and I toured the alternative care facility that has been stood back up at the Georgia World Congress Center. This is to help alleviate strains on our hospitals in the metro area as well as across the state. That facility will begin accepting patients at the end of this week, and that will be with an additional 60 beds coming online that will help ensure that our hospitals continue to have the capacity that they need to care for both COVID and non-COVID patients. I and the rest of my team remain in constant contact with hospital CEOs throughout the state, and all of them have expressed a lot of hope and excitement with the rollout of the Pfizer and the Moderna vaccines in their facilities. Like them, Dr. Toomey, myself, and our teams are all eager to get the vaccine to as many people as possible. With that said, last night we made an announcement on expanded plans for vaccine administration for Phase 1A these next couple of weeks, provided the state receives adequate vaccine allotments. In the next 2 weeks, we hope to be able to expand 1A criteria to include police, firefighters, and those over the age of 65. Dr. Toomey can speak more to the specifics, but this step will allow us to target the limited supply of the vaccine we have to those who would benefit from it the most, while we wait for additional guidance from CDC and Operation Warp Speed on new phases for the rollout. We had a great meeting, as I mentioned yesterday, with Dr. Redfield and the CDC leadership. And one of the key topics that we discussed was strategic deployment of antibody drugs in outpatient infusion centers to reduce hospitalizations. These drugs have been shown to reduce hospitalizations by as much as 70% and are designed to be administered just after the high-risk individual develops symptoms or tests positive to limit the progression of the virus. In the coming days, we will be working with our partners at public health, our nursing homes, federally qualified health centers, and hospitals to build a network of outpatient infusion centers. And we'll continue working around the clock to ensure that Georgians have access to quality care, these treatments, and the vaccines under the parameters of Phase 1A. I wanted to end tonight by talking about New Year's Eve. I've been clear with the people of Georgia this week. The virus is still here and presents as big a threat as ever. We need all Georgians to continue to act responsibly in the best interest of their loved ones and fellow citizens to limit the spread over the holiday weekend. Limit your gatherings to small groups of people within the same household. Consider gathering virtually to watch the ball drop tonight. Avoid including elderly loved ones or those who are more susceptible to the virus in your plans. And please consider the risk of going out for New Year's Eve tonight or through the weekend. If you do go out, I would encourage you to avoid going home these next few weeks to prevent the spread of the virus to other loved ones or other individuals that would be more at risk. As I mentioned yesterday, the largest percentage of cases that we're seeing in the state are coming from 18 to 29-year-olds. They have not been hit hard in most cases by this virus, but if they infect others, that is where we see problems and the risk of someone being in the hospital or worse. Our guidance on limits to bar capacity and gathering size remain in effect. And as I said yesterday as well, they can be enforced by any local or state law enforcement. We are each responsible to our fellow Georgians to stop the spread of COVID-19 while we administer the vaccine safely and efficiently. And if the people of Georgia will hunker down for a little bit longer, stay vigilant, and do the things we've been talking about, wearing a mask, washing your hands, socially distancing themselves, and following the health guidance in our executive orders, we can all have a safe, happy New Year and look ahead to the continued miraculous rollout of this unbelievable vaccine and the rest of 2021. I want to thank everyone for being here today. Thank those for following the guidance. Be safe tonight and throughout the weekend. God bless, and I'll turn it over to Dr. Toomey.
Thank you so much. I wanted to talk a little bit more about what we are doing and how we're doing this and why we're doing this. I think the data are very clear. Individuals 65 and older are at high risk for complications of COVID, high risk of complications such as hospitalization, but also death from COVID. And it really made sense for us to move into this additional category to offer vaccine for such vulnerable individuals at a time when, sadly, we are not getting the kind of uptake of vaccine by healthcare workers all over the state. By contrast, here in Metro Atlanta, there's still a waiting list of hundreds of healthcare workers waiting to get vaccinated. But in many parts of rural Georgia, both in the north and the south, there's vaccine available and literally sitting in freezers. That's unacceptable. We have lives to save. And so we decided in conjunction with Governor Kemp and shared with our health directors statewide that we would move forward with this important change because it will save lives even as we continue to vaccinate healthcare workers who are putting themselves at risk, as well as police, fire, and other law enforcement who are also often the first responders at a scene and at risk. I want to talk about Metro and what we envision over the next several weeks here in Metro to try to fill the gaps and ensure that all the healthcare workers in Metro who want to be vaccinated can be vaccinated. Is we are setting up a series of clinics. We envision a number of drive-through mass vaccination clinics where multiple people can be vaccinated at the same time, potentially in partnership with some of our university partners, and we'll be able to do thousands of people within a day rather than just 100 in a clinic. And so we expect to do that in the week or two ahead, and then can confidently begin to make appointments for individuals over age 65. And we have on our websites the capacity to click on a link and be able to make an appointment for a vaccine, and that's how healthcare workers as well can get vaccines. And so expect to see that, and a lot of public information coming out about those clinics here as well as in rural areas. I suspect that already many providers are beginning to offer vaccine because they have it in their freezers, and we will continue to roll that out very aggressively as we get vaccine. I guess there's two things I want to point out again. Please be patient. We don't have as much vaccine as we do have need for vaccine, and we will be having to make appointments so we can literally match the number of vaccine doses to the number of people who can come that day, rather than have a situation where there are many people waiting and we don't have enough vaccine available. I think the other thing is we hope that we can address some of the concerns people have about the vaccine. I was relieved when the vaccine became available here in Georgia because it's going to be our tool to end this pandemic here. But that's only going to happen if at least 80% of Georgians are willing to take that vaccine, because that's how many people are required within a given area to have what's called herd immunity, or sufficient immunity that there's not ongoing community spread. And at a time when we're seeing the highest community spread we've ever had during this pandemic, I think it's even more important to recognize that this is life-saving and can stop the pandemic and get back to normal life. We're anticipating this rollout, as I said, in the next several weeks, but even more quickly in the rural areas where there is vaccine available, as we're continuing to follow up with the healthcare providers here in Metro. But then we will roll out into other areas, and we'll be very sure to have a lot of information, a lot of public communication about who's next. And as we get additional vaccine, we want to make sure we have enough vaccine for everybody we're offering it to. And so I think that communication channel is particularly important. The other thing is that we have over 1,000 providers that have signed up to be providers. Not all of them currently have vaccine. Now that we've moved into an additional category during phase 1, I think you'll see many of them beginning to offer vaccine in their offices, which will be an additional place that the public, and particularly these older individuals, can go to be vaccinated. And we are going to do active outreach to additional providers to ensure all those who have enrolled get additional vaccine and get their orders in, but also others around the state who may not have signed up, to encourage them to do so, that we truly have the state covered with vaccine. But I think this is a fabulous way, a happy day to end 2020 with an announcement of the potential to save many, many lives in Georgia, even in the next several weeks. So I really appreciate you being here, and I'm just grateful for Governor Kemp's support for moving forward. Thank you so much.
All right, any questions? Yes, ma'am. Yeah, I'll let Dr. Toomey speak more to that. She's probably got more later data, as we say sometimes, on that. I will say that's what's so interesting about the scenario that we're in right now. I want Georgians to know that we are going to be, I told people when we started the vaccine rollout that it was going to be a methodical process, and that we knew we would hit situations that, you just don't know how this is going to go. And that's the problem we have right now. We have more people that want to get vaccinated in the metro areas than we have vaccine, and it's completely the reverse of that in parts of rural Georgia. The demand is not there from the people that want to get it, but the vaccine's there. So that's why we're changing, we're moving. We talked to Dr. Redfield about this yesterday. The CDC guidance is exactly that. It's guidance, but every state's different. They got different scenarios, and we're dealing with the Georgia scenario. And like Dr. Redfield said, and Dr. Toomey and I both agree, if there's a vaccine sitting in a freezer somewhere, that is not what we want. We want somebody to be getting it, and that's why we're expanding the criteria. From all indications that I know, we're going to continue to receive shipments of the vaccine, and we're going to do everything in our power to get it administered as quickly as we can to the people that need it in an orderly fashion. And I'll let Dr. Toomey speak to the amounts.
This always happens. I get stuck up, but hey, this is I wear my mask. In Metro Atlanta, we are actively vaccinating now. And so it isn't a lack of vaccines. It's just really having the capacity to vaccinate the number of people who want it, which is a good thing, that there are healthcare workers here who want to be vaccinated. And that's why, yesterday when we met with the Metro health directors, we thought that the best way to address this is to have a mass vaccine clinics, several of them, probably throughout the metro area, not just in Atlanta, but in a number of areas, and they're working together right now on that. And I suspect we may see it as early as next week, as we must ensure we have enough vaccine, but we are likely can do like 5,000 in a single clinic, and that's what we're aiming for. But right now, we are vaccinating. I know that many of the public health districts in Metro are having vaccination clinics this weekend after New Year's, and so that will continue. So it isn't that we're not vaccinating, we are, but the priority will be to get the healthcare workers, but we'll quickly move into that other phase of vaccinating, particularly the 65 and older, which is of great concern to all of us in public health. I mean, allocation is the vaccine that's come in, distribution is where it's gone, but that doesn't mean equilibrate into vaccine in arms. And it's a little more complicated to get it from the box into people's arms because of the logistics of how we do that and how you set up. And that's why it's so important for us to have appointments. I saw a news report of other states where they had people, waiting overnight for vaccines. That's just unacceptable. We have to make sure we have the vaccine available, but that it's easy for people to come in and get that service, just as it was for individuals to get the COVID tests at our test sites. So we're trying to aim for that same customer service and ease, as well as educate everyone about the safety and efficacy of this vaccine. And if there's anything that you all can do to help us, please help us get that message out. I have looked at the data, I have looked at how the vaccines were developed. Nobody cut corners. They were able to do it in a record amount of time that surprised many of us in the public health field, but it wasn't because any safety measures were cut. The paperwork and the bureaucracy, was streamlined to be able to make it fast because it's needed fast. And I hope that as other people get vaccinated, as people's mothers get vaccinated, that they will be willing to get vaccinated as well. Well, there's a couple of issues. One is the vaccines delivered is always a day or two behind because we only know what people have entered into the vaccine reporting system. And so we know we've delivered more vaccine into people's arms than we actually have reported because we're dependent on people, providers, whether it's public health providers, private sector providers, hospitals, reporting that. And that's true statewide. And Dr. Redfield even talked about that with me yesterday, is that, there always is going to be a delay in reporting. And so it looks like we haven't done our job. But in fact, we have. It just takes a while to have the numbers catch up with where we are. And the other thing is, I think as we get more providers on board with vaccine, we'll be able to actually increase that considerably. So I'm not worried about that. This is something that you're seeing in virtually every state, and that part of that lag is just reporting, and part of the lag is just being able to set up the clinics and ensure there's the appointments that people can get in and not be waiting, as happened yesterday in sister states. Well, we talked about that. We actually talked about that, and one of the decision points was we need the vaccine and want to begin to expand vaccinations to older individuals who are at high risk. Older individuals, along with the long-term care facility residents, are at the highest risk of death and complications. You have it here. Why not just begin and be very aggressive here in Metro to reach those other populations rather than take away from somebody else. And we can do that. We have sufficient vaccine on board now and expect more in. We were told yesterday in CDC in 2 shipments. So I think that we'll be set, and particularly with these mass clinics that we're planning to do in partnership with some of our university partners, we'll be able to process those quickly and then also move into the additional risk groups as well. So and transporting vaccine also isn't that easy. Remember, there's a cold chain you have to follow. The worst thing that could happen is you say we're going to transport it and then you waste vaccine because you break the cold chain. That would be a true tragedy.
Well, I think the team just told me too, we actually got 120,000 doses of vaccine this week. We don't know what we'll get next week, but you have to assume the supply chain is going to keep coming. So really by the time we tried to do all the logistical things to move the vaccine around, we'll have new vaccines. So it really it's not worth it. We're better off just getting that vaccine to people on the ground today, in the next couple of days versus trying to move it and it'd be 5 or 6 more days and then we have other vaccine coming in. And that's part of what our team is working on now. I mentioned the infusion centers, but we're also continuing to change and look at the logistics, so we're getting the vaccine where the need is. I mean, this is one of the things this whole plan that we have, we're going to change it weekly if we need to get the vaccine where the demand is and where we need it to protect the most vulnerable, to try to give some relief to our hospitals, and that is our commitment to continue to do that. All right. You want to speak to that, Dr. Toomey?
This is really an unusual situation in that the CDC works with either McKesson for Moderna or Pfizer ships directly to our vaccine sites, whether it's a hospital, a private provider, or to our public health clinics. We do have some being shipped just to have a backup in case there's a shortage at our storage site that holds a stockpile. So those logistics are handled through Operation Warp Speed. When you transfer from one provider to another, then we would engage the state patrol or a local ability to move. And that may happen more and more as we move further down the road, as providers only need a few doses rather than 100 or 975 doses as are in a box of Pfizer. So, much of the logistics and the movement comes directly through the CDC process, but then the local transport, when that would happen, would be through either our immunization program or likely state patrol.
I'll just add a couple of points there. One, I think a good example of this, we were at a nursing home facility Monday doing the vaccine at that facility to their healthcare workers. There was another facility similar to that one in Gainesville that didn't get the allotment Monday, but I found out they got it Tuesday and were overjoyed. So they didn't have the vaccine Monday, but it got to them Tuesday and they immediately started inoculating their staff and residents. I would just tell people that in the days to come, as this plan continues to broaden out to the general public, we will use every resource that I have available to me, whether it's law enforcement, other agencies that we've had at our disposal, just like when we shipped, if we needed to fly a ventilator to a hospital, we did it. If we needed to fly surgical gowns, masks, PPE to medical facilities early in the pandemic, we did it. We've had State Patrol drive, we've had DNR drive, we used the National Guard in a lot of places, testing sites, infectious disease control, cleaning. They're still working at our food banks. We will use every available resource to get the vaccine out as quickly as possible to help be part of the existing logistics network that we already have with, what Operation Warp Speed is set up and where the vaccine's going, and we'll continue to do that as this broadens out to the general public. Well, we are continuing and have been for probably almost 2 weeks now at looking at additional bed supply to be prepared for whatever's coming our way. It's so hard to predict when this peak will end and we'll start going the other direction. We can't just hope for that. We've got to plan for the worst and hope for the best. So we are currently digging into a lot of different options there. I will say that there's a lot of different places that we could do that, including outside of the metro Atlanta area to help some of our more rural hospitals. The big issue that we have and every state has is staffing, and that is in a short supply right now. So we're continuing to try to work through, how we deal with that, which is one reason that we're going to be pressing forward with these infusion centers, because we can cut down on the number of these vulnerable patients that may end up in the hospital by getting them these antibody drugs before they get real sick. That will help us a lot. And getting people vaccinated and getting our citizens to follow the guidance and the guidelines to help. We're at a critical point, and we've been at critical points in the past, but we've got to all hunker down, do the right thing, and stop the spread and flatten the curve. All right, thank you, everyone.